Alright, so Assalamualaikum warahmatullahi wabarakatuh and good morning. So today's tutorial, I need you to answer the questions. Okay. So the first questions, because you're supposed to revise all the lectures that we have for now. So I would like you to just provide the answers briefly, because if you don't answer, I'm not sure where can you make the mistakes, and I could not correct the mistakes. So anyone want to answer the objectives of inpatient? Just for a revision, and then later I will give you questions, cases. Anyone? Objectives of inpatient. Can someone answer? There are 100, more than 100 of you. 1% answers.
Yes.
Okay.
Uh, the objective of inpatient, one, supply intravenous solution
Okay.
and disinfectant.
Sorry?
Supply IV solution
Yes, yes.
and
What else?
prepare disinfectant.
Okay. What are the main roles? What is the main function of inpatient? That is part of the main uh, role.
What scope of inpatient, you mean?
Sorry?
Uh, is
The
it
main role
the
to
work scope of
distribute.
inpatient?
Yes, yes.
Uh, to
Same lah.
for drug distribution,
Yeah.
dispensing,
Okay.
and medication counseling.
Okay. Good. So yang apa IV solution semua tu just too specific and is part of the ni lah. Okay, it's part of the ni. But whatever answers that is related to the work, the scope and the job scope of the inpatient, then would be correct lah. Okay, so generally that is the basically to distribute the drugs and the supplies, and sometimes disposables we also supplies lah. And also the components. Okay. Okay, drug distribution activities. Okay, I think it's the same lah. Yeah. Okay, components of drug distribution activities. So can someone just summarize what are the components of the drug distribution activities? Who are involved, and what are these unit of use and unit of dose? I think it's very easy, but I just need someone to answer, just to make sure people don't confuse. Sometimes it's confusing, so now I know. Maybe someone can please summarize the answer. Come on, we have so many cases that we need to discuss. All right. Very easy. Anyone?
The nurse in charge will pull the trolley to the inpatient pharmacy, and the inpatient pharmacy will check the prescribed medication and fill in the bin of the trolley with the medication, and counter check by another pharmacist before distribute to the ward inpatient.
Okay, so there is a method for drug distribution activities, right? So there are two. There are medication trolley and with prescription, and also the apa lagi satu?
Emergency trolley.
Emergency trolley or floor stop, right? Okay, that is sent to the ward without any specific patients. Okay, and then the use of unit of use and unit of the system applies to which trolley? Unit of use and unit of the systems applies to which trolley? Medication trolley ke, or what, floor stop or emergency trolley?
medication trolley.
Okay, so we are going to apply this a bit later for the cases. So I noticed just now you said filling and counter checking and supply, but there's no proper step there. When you receive a prescription, what is the first step?
Screening.
Okay, screening for what?
Review the medication name and the dosage regimen and the prescriber. The to make sure that the prescriber prescribe the medication that according to the formulary medicine.
Okay, so there are 5 R. Okay,
For right
so
patient, dose, right administration, right medication, right frequency.
so you need to remember this 5 R. That is very easy whenever you screen a prescription. Because you need to make sure, why do you need to screen this? Because you want to make sure correct lah everything kan. Because we need to make sure the 5 R. Right patient, right medication, right route of administration, right dosage form, everything lah. Okay, and then of course the prescriber and also the date. Okay, make sure the date. Kalau the date tu expired ke apa, then tak boleh lah. Make sure the date, the prescription is valid, is still valid. Okay, how do you supply? Tadi dah ni lah. Okay, so let's just move on. Okay, so ward pharmacy. How do you take the patient medication history from the ward? Yes, for the clinical pharmacies. Okay, ward pharmacy services is provided by clinical pharmacies. And how do they take medication history? Can someone explain what's the how the process that I explained hari tu? What's the process? What's the cycle of job scope of a clinical pharmacist? Hmm? Tak ingat? Sebab tak ada position dalam government dah. So, tak ingat. Apa job scope? Dia supply UOU, UOD ke? Buat pharmacy or clinical pharmacist ni, dia buat apa? Medication trolley. Nobody remember the lecture? See the name. Okay. Aisyah, Humaira?
Yeah.
Okay.
The job scope of clinical or what pharmacists to check, screen, review patient medication, and also doing word round.
So, does a clinical pharmacist supply medication trolley?
Supply medication trolley for inpatient pharmacies.
Okay, so clinical pharmacists, they don't do the medication trolley. Okay, but they care more on the pharmacotherapy, the clinical clerk sheet. They clerk the patient and they identify what? Identify what? The drug-related problems and pharmaceutical care issues. Okay, what are the example of drug-related problems?
The side effect of the drug.
The side effects. Okay, if you administered one medication yesterday and then suddenly the patient developed today's side effects, today, and then if you didn't clock and you don't go to the ward round, you don't know. Like inpatient pharmacists, they don't know because they don't go for the ward round. But for a clinical pharmacist, they go to the ward and then they interview, they observe, they follow each patient of their patients in the ward. So they know what the progress, any changes happen to the patients. Right. So they use the forms for clinical pharmacies. What are the forms? What are the forms involved in clinical work round? In,
There are 4 forms.
mm,
The first one is CP1, Medication History Assessment Form.
okay.
Then the number 2, CP2, Pharmacotherapy Review. Next is CP3, Clinical Pharmacy Report Form. And the last one is CP4, Discharge Referral Note.
Okay. So okay. What about the medication counselling? So who can do medication counselling generally to the patients in the ward? Which pharmacist can do medication counselling to the patients in the ward?
Inpatient pharmacies.
Inpatient pharmacists, okay. They can also do it if there is no clinical pharmacist in the ward. Okay, they can do the medication counselling, whether for bedside counselling or discharge counselling. And then another one is clinical pharmacists lah. If if the patients are under their care in the ward, then they need to do it. So they can be done in counselling can be done by individual and the group. Okay, so ward check inspection. What's the purpose of ward check inspection?
We want to see the documentation, the expiry date of the drug.
Where?
In the floor stock method.
In the floor stock can, and in the for DD, PSY pun okay. So the workflow process when you receive a prescription for psychotropic medication for a patient in the ward. Ni dekat inpatient lah ni. So this is also done by pharmacists. What check inspection ni is done by inpatient pharmacists. And psychotropic, okay, what will happen when you receive a prescription with psychotropic medication for a patient in the ward? So what's the workflow process? Can someone explain the flow? Okay, Nur Izzah. Okay. You want to answer? No.
For psychotropic drug and dangerous drug, every time the pharmacist want to take new drug, they have to exchange the old drug. But if we have to change that, and then we check, and we must to check the physical. We have to every drug manually, and then we compare and discard the used drug, and then we supply the new drug.
Okay, so kalau the one that you said that the used or unused to the broken ampoules or the vials or any containers that is used for the drugs, but like if tablets, then you can also check the balance lah, calculate lah kan. Kalau 1.5 tablet pun you need to include. Okay, so the documentation for the psychotropic medication.
So there will be each book. There will be books for each strength for the drug, every drug, and then we have to take note the stock balance, who supply the medication and who receive the medication, the date supply and supply to whom, and we have to write in red or in red pen.
Red pen untuk apa?
For adding new stock or for correction. and black or blue pen when we issued out the medication.
Okay. Alright, so the DPSY can only be accessed by the pharmacist only. So now the workflow process for bedside dispensing and counselling by an inpatient pharmacist when a patient is discharged from the ward. Can someone explain how are you going to supply and dispense and counsel the patient in the ward, and how to refer the patient for follow up or TCA to collect the balance of medication? What's the issues here when you dispense and the medication for discharged patients? Anybody remember how to do it?
For discharged patient, if the hospital has satellite pharmacy, then the patient can receive the discharge medication at the satellite pharmacy. Is that correct, Doctor?
Satellite, yes, can if there is a satellite pharmacy, because not all hospitals have a satellite pharmacy. Okay, that's fine. And then how do you supply the medication for 3 months?
Okay, so the prescription is for 3 months, but we only can supply for 1 month because we want to use the use of the medication if the patient need to change to new medication, and then all IV medication must change to oral form if available.
Okay. Okay, and then you
And we
supply
need,
for 1 month only, right? Then where do you refer for the balance of the medication?
sorry, Doctor?
You supply for 1 month, and then where do you refer the patient to get the balance of the medication for next TCA?
They can come to the outpatient, and we also must write TCA to come in, and we put the date. So the patient must come to the outpatient pharmacy until the next appointment with the doctor.
And bringing the prescription lah. Okay. Alright. So now, okay, example here. You receive a prescription from a pediatric ward for an infant aged 12 months. So for a 12-month-old, what's the first thing that you need to think about when you want to supply medications to infants? What are the specific criteria or requirements that you need to consider before you supply medications to infants?
The strength and dose based on their weight.
Yes. So how do you check the weight?
BSA.
BSA. BSA itu apa?
Body surface area.
Yes, usually kalau for certain medications only lah for BSA tu. BSA is for certain medications only, and where it can be used usually body weight lah. Okay, usually body weight. Usually kalau babies, very small babies macam 3 months ke macam tu, then some of the medications need to use DSA, but generally if older babies like 12 months old, we use weight. So you need if you don't have the information, you need to call the ward and then confirm the weight, right? And then how do you know the dose of the patient, the dose of the medication is suitable for this patient? How do you check the dose for pediatric? Refer what guideline? What book? What handbook? Which handbook you refer?
Frank Shan, Doctor.
Okay, so you always refer Frank Shan, okay, and then check whether 15 mg per kg, and then you times lah kan berapa kg, and then you check the berapa mg kan, the total, and then how much ml usually. Okay, so when pediatric you check the dose and you check whether the medication is suitable for the patient and the dosage form. Okay, it's not the same as adult, so you need to check the dosage form and whether the medication is suitable for a 12 months old, because there are so many medications which are not suitable for less than 2 years old. Okay, so every medication, even very simple one, so you still need to check. Okay, because not all of medications suitable for less than 2 years old. Okay, and sometimes less than 6 months old. So it depends on the specific medication. So suitability of the dose, the dosage form, and the medication itself. And then you calculate, and then kalau perlu extemporaneous, then buat extemporaneous labeling, everything lah, all the. So for example here, I will give you, I haven't given you the example of insulin, I think. So for example, you receive for discharge patient, TCA for 3 months. So subcutaneous atropine 12 units TDS for 1 month on admission. Okay, so no. Okay, so now the patient is admitted, okay, and then you as an inpatient pharmacist, you need to supply the medication for until the next trolley day. Okay, please ignore the below part first. The lower part you please ignore. You consider this first. As an inpatient pharmacist, you receive a prescription with the medication trolley. So this is the prescription: subcutaneous atropine 12 IU TDS for 1 month, and subcutaneous insulatard 12 IU ON 1 month. So your unit of your system, you calculate, you need to only supply for 3 days lah until the next trolley day. So how many units and how many vials you need to supply? 1 vial contains 300 units. Okay, 100 units per 1 ml. So total 1 vial is 300 units. So how many units and how many vials you are going to supply for 3 days? Can someone please calculate and tell me? Simple maths je ni. Just to give you a scenario. 12 times 3 berapa?
6.
So berapa for 3 days? How many units? Atropine, how many units? Insulatard. Insulatard is given ON only, at night only, because it is intermediate acting, so it controls the fasting blood sugar in the morning. Okay, so it is given ON only, and no need to eat any meal. But atropine TDS before meal, half an hour before meals. So how many units? Insulatard 12 times 3 dalam 36 units kan? So berapa vial? Ni atropine, ni insulatard. Can someone just confirm how many vials je? Very easy. I want to move on to the next question.
1 vial each.
Okay, so 1 vial each. So bila you kira ini berapa? 36 kan? Times 36 per day, units per day, and then times 3 berapa? 100 plus kan?
108.
Okay, so 8 kan? So 1 vial ada 300 kan? So ada balance dalam 200 units kan? So even the next 3 days, when you receive a new prescription of the same medication here, you don't need to supply, because unless the increase of medication that seems like is going to finish soon lah. But let's say if you same prescription on the next trolley day, for insulin you should not supply. Why? Because you need to check first with the ward whether the one that you supplied in the last 3 days still have the balance, and then still can be used. So if there are still balance, then they need to finish that first. So when it's almost finished, then only they can send a new prescription, a new order for atropine. Why? Because we have a lot in the new, and itu maybe can last maybe 1 week ke apa kan. So ini insulatard ni lagi lama lah, because ON only once a day kan. So 12 times berapa? So now here how many you supply is 300 units. You divide how many dose per day. So how many days the one vial will last. Okay. So in this case you know how ni lah because you just divide. Okay, divide. Kalau outpatient pun macam tu jugalah. Okay, let's say lah you bagi ni for outpatient. Okay, this patient, can you follow this? Now let's forget for a while for inpatient. Let's say you as an outpatient pharmacist, you receive ni 1 month. So you need to supply for 1 month, right? Faham tak? I just want to make sure if you can still follow. So how many? Okay, so how many? How many total units? If you as an outpatient pharmacist, you want to dispense the vial, how many vials? You want to determine how many vials. So 12 times 3 times 1 month. Berapa? Ini pun 12 times, okay, once a day and then times 1 month. Yang ni berapa vial? Yang ni berapa vial? Kalau inpatient, of course, you can only supply for 3 days or depends lah your unit of use and unit of dose tu. Kalau outpatient, you can supply for 1 month, right? So how many vials?
Doctor, 4.
Mana? Atropine?
Atropine, yes. Atropine.
Okay, how many total units?
180.
180?
1,080. 1,080.
1,800?
80.
1,080, 1,080?
1,080.
Oh, okay, so 1,080 you divide 300 kan? Okay, so dapat 4 vials.
3.6.
Okay, 3.6, 4 vials lah. You cannot give accurately kan, because this is in a vial kan. So sama lah. Kalau sirap pun, kalau yang macam PCM sirap tu, kalau satu sirap 1 botol setengah ke, and you kena bagi 2 lah. Kalau ini 3.6 maksudnya 4 lah. Okay, so that's the correct amount that you need to supply. Ini pun sama lah kan, 12 times ni berapa, and then you supply macam tadi lah juga. Okay, so now let's go back to inpatient. Okay, tadi example of outpatient you already calculated. So now let's come back. Okay, after 1 week you dah supply lah ni. You dah supply all the HPP and insulin. And then 1 week, patient ada lagi lah ni 1 week ni. Then dia increase to ni. Okay, the insulin is increased, the dose, 16 PDS 1 month and then insulatard. So you need to recalculate lah how many days the insulin can last lah. Okay, so sama, and then dia discharge kan, TCA 3 months. So you supply 1 month and then you tulis lah TCA bila date, and then to collect dekat outpatient pharmacies. And then during the counselling ni a lot lah you will learn. Please read all the counselling point for insulin, pen, and a lot lah. Usually it takes about half an hour lah to explain everything. And the storage of insulin at home ni part of the counselling. Alright, so that's the process. Habis dah. Okay, actually I have a case I want to let me share. I need to start presenting this first. Share. Okay. Can you see? Another case.
Can, Doctor.
Okay, so this is the medication chart now. Okay, medication chart in the ward. Okay, this is not outpatient prescription, but this is also a prescription, but we call it medication chart because we medications to the ward using this medication chart. Okay, manual, kalau yang manual lah, kalau elektronik dalam komputer je. So example here, a 2-year-old, weight 12.5 kg, okay, height, and then you got here IV ranitidine, okay, 4 mg per kg BD. So I'm not sure. You need to check first. Whether this is correct dose. Okay. So BD the correct frequency or not. Okay, for 3 days. Okay, that's fine. 3 days. And tablet folic acid at 5 mg. So because this patient is a 2-year-old patient, so impossible lah to give tablet. Okay, so what you can identify here is the ni lah, to change the tablet to syrup. So when you want to to change to syrup, you call lah, you check dulu the dose betul kan ni 5 mg. The dose for a 2-year-old patient. Okay, the dose can also check and frequency betul lah. And then you need to find out the extemporaneous sheet lah, the formulation to add what and everything, and then prepare the syrup of the correct strength. Okay, of the correct strength, and calculate the dose, how many mg needed, and then you calculate the how many mils needed from the strength that you prepared. I think this the similar calculations for syrup I have given in the inpatient slide. There are 3 questions, right, for inpatient slides on syrups, I think, on syrups. So have anyone attempted to answer the questions from the inpatient slides? Because it's about the calculation of the syrup. I want someone to try to calculate. How do you calculate? Because the doctors will only give you the dose. It's you who are supposed to calculate the volume to be taken by the patient based on the strength that you have. Ada tak someone ada tak yang ada lecture inpatient sekarang? Anyone? Yang page last tu ada questions. Anyone has attempted to answer? And is there any problem encountered?
Dr. is it the salbutamol syrup?
Okay, so what's the question? Siapa ni tadi cakap?
Christina.
Christina. Okay. So Christina, can you read the question? Okay, salbutamol syrup tu apa?
2 mg TDS for 5 days.
Okay, so for 5 days, lepas tu?
And then the quantity for 1 bottle is 60 ml.
Okay, 60 ml. Okay.
Received at 12 p.m. on Tuesday.
Okay.
And then the UOU system supplies medication on Monday and Friday at 9 a.m.
Okay.
So the question is how many bottles? Oh, the strength is 2 mg, 2 mg per 5 ml.
5 ml, okay. So have you attempted to answer this?
And yes.
Okay, so how many bottles did you get?
One bottle, because 1 bottle is 60 ml. So 60 ml divide with 5. 5 ml I got 12, which means satu botol tu 12 kali makan. And then one bottle for the first round. For the second trolley, another 1 bottle, because we need to supply for 5 days.
For second trolley? What do you mean second trolley?
Because we received the prescription on Tuesday.
Yes.
And then
so we can supply until? We can supply until?
Friday morning.
Okay,
Friday morning.
until Friday morning. Okay. Okay. So Tuesday, so kalau TDS ni every 8 hours, so 2 more dose on Tuesday, and then Wednesday, Thursday lah, and then Friday kan. So Wednesday
Yes.
3 doses, Wednesday 3 doses, Thursday 3 doses, Friday 3 doses. No, Friday 1 dose, 1 dose, and Tuesday.
Yes.
So total of 9 9 doses lah,
Yes.
kan? 9
Yes.
doses. Okay, kenapa you cakap 12 times tadi? This is I don't understand why. Okay, so now usually what we do is 2 mg per 5 ml. Kalau dah dose 2 mg, meaning that you need to print the label 5 ml 3 times a day, kan? Okay, so then you calculate lah kalau dah per day 15 ml kan. So 15 ml on Tuesday, Wednesday and Tuesday kan, and then total of 45 ml ke? 45 ml, betul tak? Anyone got 45 ml total required by the patient?
Yes, doctor.
Okay, so cukup lah 1 bottle lah kan? So nanti ada balance lah, you cannot give lah accurately 45 ml. Kalau sirap ni memang you kena bagi extra. And like kalau salbutamol ni sometimes maybe TDS and then when necessary. However, if syrup antibiotics, you always need to give extra, but don't finish the syrup. Kalau you bagi antibiotics tablet, you will give like if TDS for 5 days, total 15 tablets, you will give it accurately and you will counsel the patient to finish the course of antibiotics, okay? You need to finish all the medications given. However, if it is antibiotic syrup, so for example, syrup ampicillin, very common in children, syrup ampicillin, syrup cloxacillin, so they need usually is in powdered form, okay? So they are powdered, and then they have a method on adding the lukewarm water, and then up to the 60 ml line. There is a line in the on the bottle, and then they need to add and one by one lah. If you give 4 bottle for example as outpatient ke atau for discharge ke, so they need to dilute one by one, okay? First bottle, second bottle, third bottle, and fourth bottle to complete the course. However, complete the course only, not to finish all the syrup antibiotics, because it will exceed lah, it will be exceed the course lah, exceed the dose lah. So that's the you need to be particular lah what kind of medication. Kalau PCM, salbutamol, usually okay TDS or QID and PRN, then PRN necessary when necessary, based on the symptoms. But for like antibiotics, just need to complete the course. So for syrup, there will be excess, okay? There will be excess. Maybe the last bottle tu for the last dose guna 15 ml je, then the berapa 50 ml lagi tu kan, or 45 ml lagi tu, they need to discard lah or return to the pharmacy, don't finish. So that's how you counsel lah on this antibiotic. So other than salbutamol, apa lagi soalan tu? In the outpatient, in the inpatient punya slide. Ada 3 kan soalan? Okay, satu lagi apa?
Subcutaneous atrophy.
Oh, sama lah macam tadi ya, subcutaneous atrophy. Okay lah, we have discussed, so that's fine. I think you already understand how to do ini. And then another one, the last one. Other than atropine and salbutamol, the last one apa?
Tablet augmentin, doktor.
Okay, so tablet augmentin tu apa?
Tablet augmentin 625 mg BD for 5 days.
Oh, okay. And then?
Receive at 4 p.m. on Monday. UOU system on Monday and Wednesday at 9 a.m.
Okay. So you need to supply until? Kira ni dah lepas dah medication trolley ni. Medication trolley dah naik atas dah. Okay. And then suddenly you dapat a new prescription kan. So you cannot supply to the medication trolley lah. But the staff nurse will come down and collect the medication. You still need to prepare. But the duration will be until when? Until Wednesday lah kan? Until Wednesday. Okay, Monday, Tuesday and Wednesday the morning dose. So I think everyone understands lah. It's very simple lah. So okay, the new patient, I think everyone also ni, but our workshop will involve the new patient lah. So for example lah, mana tadi where is the description? Can you still see any the question that I displayed just now? Itu dah hilang.
I see the medication chart.
Medication chart. Oh, still got.
Yes.
I cannot see. I cannot see the medication chart. How can I see this medication chart? No. Anyway, I'll just open another one. Okay, so for example, here. Okay. Can you see it moving?
Yes, doctor.
Okay, all right. Okay, so here, for example, okay, here, IV ranitidine kan? Okay, IV ranitidine. For a new patient, you still need to add 1 dose. Okay. Same here, folic acid ke atau cloxacillin ke. So you always need to add 1 dose, regardless what types of medication for a new patient. Okay, that's the rule lah. The reasons behind that is just difficult to explain, but mainly because they already receive the medication in the ward even before we supply the medication. So that is about the practice. Okay, that's it's not like something that you can reason with it, but that's the rule for practice. Okay, actually this is I think we have basically discussed for, because it's going to take a lot of time for you to check whether this is suitable for pit or berapa tadi, a 2-year-old a 2-year-old, whether this is suitable, and whether this is the correct dose. And usually if you want to check, you just Google lah whether ni 125 mg per ml ni ada tak, wujud ke tak dalam ni. So during the workshop you will need to search lah the strength is available or not, and then how many supply, how many ampoules or vials you are going to supply. Okay, so I think I will close the PIPS case. I will open the elderly case, because there are different issues that you need to use the tutorial case. Do you have with you the tutorial case that I uploaded? Tutorial case inpatient. Can you see tutorial case? Can you see tutorial 1 case inpatient 2020? Can you see or not?
Yes, sir.
Okay. Patient name IH, right?
Sorry, doctor. We can see the cannot see the content.
Content?
Yes.
Oh, too small ke?
You're showing your windows, right?
My Windows. What happened to my Windows?
There's the PowerPoint PDF.
Word. It's Word. Word document. You cannot see.
Can
I'll be showing your folder.
Huh? For what? Cannot see.
Cannot see, Doctor.
how did you do this?
Um, I will try to share again. Okay, now I think you can see.
Yes, Doctor.
Okay. IAH, right? 58 years old, right? Can you
Yes,
see?
Doctor.
Okay. So IBA, acute exacerbation, bronchial asthma, secondary to CAP, with type 1 respiratory failure, serum creatinine, micro ni, bukan micro. Serum creatinine 190 micromole per liter. Okay, so here an elderly patient defined as above 65 years old. So here, if this is available, then what you should do first? In elderly patient, you always need to check lah. Apa ni? Anyone knows apa ni? What is this? Okay, serum creatinine. So what is this for?
To check if the patient has a kidney problem.
Okay. So how do you check? How do you check this? Whether there is a problem with the kidney or not? How do you calculate? How do you calculate? Inpatient pharmacist pun kena buat ni. Basic. Because doctors will not calculate the function of the renal. They just want to know the interpretation. So once you calculate, you need to interpret whether there is a renal failure or not, at which stage, severe, mild, moderate, at which stage, and is it safe to give azithromycin or not, or ceftriaxone or not? Is it safe to give hydrocortisone or not? So now, how do you calculate this? Do you have the formula? Have you learned about how to calculate the renal function, the kidney function? So please find out lah the formula. Okay, the creatinine clearance. Okay, only the creatinine clearance or GFR lah that can interpret, that can gives you the answer to interpret the function of the renal of the patient, and the stage 1, 2, 3, 4, 5 of renal failure, and whether the medication is suitable or contraindicated in a patient with this creatinine level, and whether it is suitable, but the dose need to be reduced to maybe half of the dose, or if not suitable at all, we need to change the medication to other option that is suitable. And or maybe frequency here for renal function of maybe less than 40 ml per minute, for example, the frequency needs to be increased to BD or TDS, something like that. Okay, so there are a lot of components and aspects that you need to adjust lah. Even if you are not clinical pharmacist, you are an inpatient pharmacist, but this is very basic work that you need to do and to interpret the how the excretion, the metabolism of the medications of your patients lah. Okay, so you check walaupun dah betul for normal adults, but if there are things that can compromise the excretion of the medication in a patient, then you need to consider suitability and contraindication, the reduced dose, increase or reduce frequency. Same here. Kalau ni sesuai, that's fine. Or everything tak ada problem. Kalau tak sesuai, tak boleh, you need to replace with other medications and suggest to the doctor. So stat here, apa stat? What is the meaning of stat? Immediately. So usually it has been given to the patient in the ward. So usually you don't need to supply. But if you want to supply, usually one dose only, But in practice, you don't supply usually because these most common stat medications usually already in the list of the floor stock. You already supplied for the ward for like 1 month, kan? And they have all the supplies, and then that's why they administered stat. So as an inpatient, let's say you receive all this prescription ni kan, ada 3 medications, you supply only ni je. The stat dose ni tak perlu supply pun because they already administered using the floor stock. Okay, understand? Alright. But if you still want to supply or there is no floor stock available, then you need to supply. They send the order, okay, they send the prescription and with this, and then they don't have it in the floor stock, then you still need to supply lah. But they already gave the medication using other people, maybe borrow from other ward ke apa macam tu lah. Okay, so the second one is MDI salbutamol. Okay, so here tak ada renal, tak ada state apalah. So MDI salbutamol, how do you supply? Umur 58 years old. Okay. MDI salbutamol PRN, how many do you want to supply ni? Huh? How many do you want to supply? Duration, let's say 1 month. Ini kan inflation 7 days. Okay. Ni salah lah ni, tak ada ni kan, tak boleh lah ni. You check nanti, you verify. Mana ni prescriber punya chop, sign apa semua. You need to, the date pun tak ada, tak boleh prescribe ni. Tak boleh dispense ni kalau tak ada date apa semua. So, you need to identify lah. So, make sure everything is complete. Yang macam tadi tu, yang ni semua tak ada ni kan. Yang pediatric tadi ada kan, the chop and or date, everything. So, this is just to give you example. So, how many do you think? Ni, siapa pernah pakai MDI? Mesti tahu. Berapa you want to give? PRN, lepas tu 7 days. Macam mana you nak bagi? How many MDI? How many inhaler you nak bagi? Tak berani bagi.
One inhaler cukup doktor.
One. Okay, one. Why? Dalam satu inhaler usually ada berapa dos? Biasa 200 or 300 or 400. Okay. So kalau dah PRN, usually memang it can last very long time because MDI salbutamol is only for when necessary, when they have asthma attacks kan, to relieve, for quick relief. So usually you can only supply one for 1 week. Ni maybe dia guna macam 5-6 kali je seminggu macam tu kan, and it should not exceed 4 times a day. Okay, if the exacerbations happen more than 4 times a day, then they straight away need to be. So so if you give this you dah bagi kan this week kan, okay, until the next holiday lah. Lepas tu the next holiday you still receive kan the same macam tadilah insulin kan. You don't need to supply lah because you know there are still a lot of salbutamol balance kan dekat tu ward. So just call lah dulu, janganlah tak nak bagi terus, just call and then confirm because we have already dispensed this MDI salbutamol last week, and it should last until when you have calculated kan, maybe it should last until a month ke, and then ni lah you ask lah yang you will not supply, and then if is still there a need to supply the MDI, or okay, and then suddenly patient is discharged and then in the next 3 days kan, and then you just supply that that salbutamol only lah, because you have confirmed kan dia dah ada salbutamol. However, unlike budesonide, you need to supply accurately sampai berapa lama. Okay, so you still need to know. Kalau you discharge a patient tu, you still need to make sure, calculate, because dia it needs to be taken every day, BD, okay, every day, because this is for a preventer to reduce all the inflammation, and then preventer from for the asthma attack. And you can also know whether the patient is compliant or not from the balance, or kalau dia budesonide tu can last for more than expected duration, then meaning that the patient does not comply lah for the budesonide, and because there is no effect, so many patients they don't comply because they steroid lah, there are many side effects. Alright, so tapi kalau in the ward sama jugalah, if still can last for the next few weeks ke, then you don't supply lah for the repeat prescription. Okay, prednisolone pun sama. Okay, kalau ni maybe 5 mg per tablets. Okay, so maybe this prednisolone is also steroid and is not recommended for long-term use. So now for 3 days OD is fine, and then the strength is 5 mg per tablet. So for this patient, you want to you receive this prescription in patient. So how many tablets you want to supply? Consider ni lah, you receive today at 9 AM lah to supply the medication trolley. How many tablets of prednisolone for this patient? And for example, ni lah, just to supply until the next trolley days lah ni. Okay, the 3 days is the next trolley day. So 5 mg per tablet times berapa ni nak dapatkan 30 mg? 6 kan? 6 tablets. So patient need to take 6 tablets in one go. Okay, so they need to take 6 tablets to get the 30 mg dose. So times lah 3, dapat berapa? 18 tablets. So you need to supply 18 tablets. Okay, alright. The rest tu I will give the cases for inpatient workshop. Inpatient workshop will contribute to 5% of the total marks. So it's going to be a group work. So I think time is almost up. Any question? This is conversation here. Okay. The Croft Gold. Okay, yes. The Croft Gold is for the calculation of the creatinine clearance. This you kena ingat straight away. Okay, Croft Gold ni memang is your weapon. Okay, it's your you have to know. You have to have calculator. You have to have this formula, because when you see the serum creatinine, you already know which stage, and then you need to interpret and then check every suitability to those medication. Apa ni? Okay, for one second. You jawab dekat sini ke? Okay. Okay, any questions? Any other questions? No. So should we end it here?
No question, Doctor.
Alright. Okay, so if there's anything, you can just post dekat WhatsApp group ke apa, then I will answer to the questions in the group, then everyone will know the answer, then I don't need to repeat answering the same questions. Alright, so I think that's all. We end today's meeting here. Thank you so much. Assalamualaikum. You can leave the meeting.
Thank you very much, Doctor.
Thank you, Doctor.